right, Ben, I want to talk about a disorder that we've started to see more and more here at the Sylvia Brafman Mental Health Center, DID, or Dissociative Identity Disorder. What is that?
So DID, also known as multiple personality disorder, is a condition where somebody takes on two or more personalities within their being. It's sometimes very difficult to diagnose. It's extremely debilitating, and all the cases of DID relate back to some sort of trauma.
So is that a new-ish term, DID? Because I think multiple personality disorder is like traditionally what I've heard.
Not really. I think that it's gained traction, and I think that we've been better at diagnosing it, and so people are getting help. It's a debilitating disorder.
Yeah, how does it manifest and sort of show up in somebody's behavior?
So how it shows up is people take on distinct personalities. Somebody, they might be a person who is a regular person, and then their other personalities could be a little boy or a little girl. It could be somebody who eats a lot. It could be somebody who's a different color. It could be somebody who's like ultra religious. So it just takes on and it manifests, different types of personalities based on a person's history, their culture, their genetics, and as I said before, the trauma is the key trigger to DID, multiple personality disorder.
So it's I guess not just personalities, right? Like I have, I guess, different personalities. Like I think we can all be shy in, some groups of people, maybe a little bit more outgoing in others. This is like a different identity. And so they think that they are somebody else with a different, history, essentially, right?
Correct. That there is a distinction with that, and they do think that they are somebody else completely.
So if you were to stop somebody who has this disorder while they are a personality that is, whatever, call it a religious leader or something, and you were to say, hey, you are John C., you are not whomever, would they be able to acknowledge that in that moment or no?
It depends. Probably not. There's a psychological term known as fuguing, where patient just sort of they don't have a check in reality. They space out over time. They have no memory of things. It's a very difficult disorder. It's difficult to treat. It's painful for the patient. It's painful to watch the progression because you're at different levels. When a person starts to have insight into this disorder, it's very painful. They don't want to do certain things, but yet they still are doing things that are hurtful to themselves. For example, people will become promiscuous. They'll use drugs because their identity is, John the drug dealer, and again, your gender has nothing to do with it per se.
Yeah. So how do you go about treating it?
Good question. Treating it is difficult. You certainly there's a medication intervention. You want some type of mood stability. But honestly, it's a lot of the trauma work. That coming to terms with it, almost rejoining the trauma event and working through that and retelling your story, integrating that into reality.
So sort of, what we talk about in-house in terms of EMDR, other modalities to sort of resolve trauma?
That's right, like cognitive behavioral therapy, identifying irrational beliefs. And here's the good news. The good news is that someone with DID can live a pretty good life. They can be pretty normal. They can hold a job and they can do things that other people do. It's not a death sentence, and your life is not over, but it takes a lot of work.
And so is it a response to the trauma, right? It's like a subconscious kind of coping strategy?
That's right. That's right. It's a severe response. It's sort of like off the edge response. And, the stats on it are not great, but you can get help with it.
And I know you've done a great job of that with the clinical program here, helping folks that come in with DID. So thanks for sharing.
You got it.